New normal. Today we're talking about life after lockdown and how we can cope and deal with the stress and anxiety so many people are feeling. And this morning we're speaking with Dr. Julia Samton. She's actually double board certified in psychiatry and neurology and trained to help people overcome a variety of mood disorders. So remember, we do want to hear from you for the next half hour. We'll be answering your questions live, and you can submit them right now on our social media pages. So thanks so much for joining us, Dr. Samton. And we want to jump right in and talk about a mental health crisis. A lot of people are fearing that that's going to be the next crisis that we're entering. So I guess the question is, what do we do now, knowing what we know and where we are, to try to prevent something like that from happening?
Well, that is an excellent question because, of course, as humans, we all are facing a certain degree of anxiety right now. I like to sort of explain that COVID is a collective trauma that we've all been undergoing. We came from having sort of our rather, would you say, easier lives. They weren't perfect, of course, but they were most certainly easier to have everything turned upside down. And some of us are pretty shaken. In terms of moving forward, what we can do to fortify ourselves, there are several things that we can do. Number one is to do whatever we can not to fill in the blanks of the uncertainties ahead with worst case scenarios. This is a very, very common human trait. It's something we all do, and we need to, once we realize that we're thinking about all of the worst case scenarios of what will be, to kind of bring ourselves back into the moment and recognize where we are and not be dealing with all the disasters that our mind is creating for us.
I was talking to you earlier about being nervous in the hallway. And
Yeah.
I think of how many people are, as our Connecticut, New Jersey, New York, Long Island, Hudson Valley, all these areas are starting to reopen and people are starting to venture back out again, whether that's to the beach on the weekend or going back to work and having to go, on mass transit, and to go from a situation where I see very few people to all of a sudden being inundated by people. How do you handle, coming back out again?
Yeah, change is very hard no matter what direction. And we've all been sort of cocooning in our homes, creating, sort of comfort where we can. We've been isolating. And that's been helpful in some ways. And maybe in other ways, it's actually been making us even more anxious because social connection is so important to us. And ultimately, it is going to take a little bit of a leap of faith that we're re-entering the world, and we're re-entering to it living with the virus, not running from it, but living with it, and to sort of have faith in ourselves that we can use the measures that the CDC and other authorities have guided us. For example, the mask, not touching our face, hand washing, 6 feet apart, etc. That's going to give us a tremendous amount of comfort to control the uncertainties that we know. And the rest, we're going to begin to really just kind of have to take that leap and start living our lives, even though we recognize that we might be feeling a certain amount of hesitation.
There's a new report from the American Psychological Association, and it found that more than 80% of U.S. adults report that the nation's future is causing them a significant stress. And it seems to be like a coupled stress because there's so many different factors. So I guess what can we do when we feel that pressure kind of on all sides, whether it's helping with your parents and your kids and your job, and then all these things happening simultaneously?
Yeah, we have our hands full. Our nation is going through a tremendous transition. In some ways, we are growing. We have we're handling many different sort of fears of our own as well as our children. Exactly what you said, maybe taking care of elderly people in our lives. We have our hands full. And what we want to remember is that the most important thing in that whole picture is that we do what we can to remain anchored. And we do what we can to recognize that no matter what life is bringing us, that if we are working on how we're feeling on the inside, and we can work towards feeling more centered and more grounded, then we can just handle things as they come one by one. I think some of the anxiety that we're having right now is actually somewhat adaptive because we are afraid of a virus that we've been told can be deadly, right? The first 200,000 years that we were on this planet, we were running from deadly predators. We are all very, very geared to knowing how to survive that, right? We have survived that. We are now sort of masters of the universe, and our brains are trying to figure out how we can overcome this danger. So some of it is adaptive, but another piece of it really can be quite destructive when we let our worst fears and the worst case scenario overcome us.
And when we talk about anxiety, I think a lot of people, use that phrase. But for people who maybe have a previous diagnosis, they have a better understanding of exactly what it is. Not to say that they're in a better place, but they maybe have already met with someone and have those
familiar.
Yes. But for other people to say, I think I have anxiety. But what does that mean?
Right. So anxiety in general means fear of the unknown, fear of the future. And we can sometimes feel it in our bodies. Our muscles become tense, our heart starts to race, we might start to sweat, we might start to feel very sort of pumped up and amped up. Other times it's our thoughts that are out of control. Oh my God, what if, the worst case scenario is coming for me. If only I had done this differently, my life would be different, etc. Those kinds of phrases, those kinds of sayings are very, very common, and they start to really feed the emotions. And most of the time when we talk about anxiety, what we're talking about is fear. Fear of the unknown, fear of what's going to happen to us, fear that we've wildly screwed up our lives somehow. And what we need to kind of continue to remind ourselves is that most of us can really respond to, are very good problem solvers as long as we stay where we are in the moment and not let our brains and our bodies get the best of us.
So for friends who reach out and are able to articulate how they're feeling, whether it's grief or fear, uncertainty, and they try to gauge how you're feeling, what are some of the tips or, tricks, for lack of a better word, that we should try to use as we start having these mental health conversations with our friends and family right now?
That it is our job, each and every one of us, to work on how we on the inside can feel more centered and more grounded. There's so much happening in the world right now. It's quite overwhelming. I mean, every day we sort of hear more and more stories about how our world is changing. And oftentimes it doesn't look like it's for the better, although I have a hunch actually some very good things will come out of this, aside from obviously lots of loss as well. But that being said, we tend to really pay attention to the negative things around us. So what I would like to say is that, recognize that as human beings, we have known to be, we're described as being Velcro for the bad and Teflon for the good, so that we have a little bit of a predilection to look for the negative things that we can avoid in our environment. Let's try to stop doing that, try to look inward and see what we can do to reassure ourselves. So sometimes that means going for a walk, sometimes it means keeping regular exercise, sometimes it means doing things like maintaining a meditation practice, journaling, expressing gratitude, things that we can do with ourselves to help us feel more at peace, more at ease, even if the world around us seems tempestuous.
And we were talking a little bit before about, people who have some pre-existing conditions like depression, anxiety, substance abuse, or eating disorders, and a lot of that they can find that trigger in this climate because there's so much of that going on. So obviously you can't meet in the way that you used to or do some of the things that you used to. I know I have a friend who says, like, I need to get to my yoga class. I can't do Zoom anymore. They need that connection. So what can you do until that time comes?
I have to say, I have been continually impressed with how resilient we are as humans, and I think that we have to really sort of embrace our creative spirit and try to figure out other ways that we can manage our feelings. A lot of the things that you just listed, um, things like substance abuse and maybe even overeating, etc. Those are ways that people try to get rid of their anxiety. If they're feeling sort of fearful, they're feeling down, what do? We try to reach for something from the outside in order to quell that. Sometimes it's alcohol, sometimes it's food. But that being said, what we can do instead is try to think about ways, instead of reaching for the outside, that we can take care of ourselves from the inside. So sometimes that means streaming a class. There are plenty of online support groups. Reading fiction, that has shown to be a huge anxiety reliever. As I was saying, engaging in something as simple as a meditation practice, that is something that costs nothing, that you don't necessarily need to do as part of a group or a community. You can download an app. It's a huge way to build resilience, to build that inner musculature, to help you feel fortified to handle whatever comes your way.
All right, we're going to continue our conversation straight ahead with more information on, keeping our own mental health well at this time. And do remember, we want to hear from you. You can submit your questions right now on our social media pages. We'll be right back. Okay, we are still on Facebook. So hello to everybody on Facebook who is still joining us. I'm just going to move some of my notes for 1 second. Just bear with me while I do that. I think I got it. Sorry, thanks. Okay. All right, so in the next section, I'm sorry, I'm just reading what I have here.
No worries.
We're just gonna chat about mental health screenings, and if there's certain things that you should, whether you go to your primary care physician or whether your OBG, whoever, if there should be some type of a screening or a conversation, if you have felt this way and you have a regular doctor's appointment, but you know what I'm saying, a doctor's appointment, because also some of the mental problems that we might be having can also have those physical symptoms. So headaches or tension, stomach issues that could possibly coincide with what's going on.
Yeah.
Okay.
Yeah.
And then we do have
News 12's closed.
Okay, sorry there. So we do have our first question about her fear because of unemployment, and then we have another one in that says, you don't have to answer it now, I'm just letting you know what it is, so when we're live,
yes.
It says, I've already had anxiety for a very long time. This has been so hard, worrying about my kids, my family, and praying for everyone. I'm constantly calling everyone to check up on them.
Okay.
Okay, so that was, so that's the next one in our queue. So this next section is a little bit shorter than the last one, just to give you a heads up. Okay. Got it. Okay. What's the time back? Oh, okay, so we're 30 seconds away.
Okay.
Oh, okay. There's another one after the next one, but I can't read it yet. It just didn't populate, but just to let you know. Okay. So you might lose my audio for just a bit.
Okay.
10 seconds.
News 12's closed captioning is brought to you by Earworks Audiology, 11 Long Island locations, the sound choice for better hearing.
Thanks for joining us here at News 12. Welcome back to the New Normal, a special report, and we continue to answer your questions live this morning, so you can send in your mental health questions right now on our Facebook pages. And joining us is Dr. Julia Samton. She's a psychiatrist and helps people deal with the impact of this pandemic on their mental health. So I'm just wondering, for people who have, whether it be a telehealth visit or a primary care visit, are there certain symptoms that you should let your doctor know about if you are heading to the doctor?
Oh, absolutely. For whatever reason, if you are going to the doctor, whether it be for a well check or if you're going for a specific medical problem, it's a good idea to talk a little bit about what's happening in your mental life, how you've been feeling, because as we know, anxiety, depression, and other mental health issues can exacerbate illness. Even if it's a chronic illness, it can exacerbate illness. And of course, it also suppresses immunity. So it's something that's really important for your doctors to recognize. And if they know what's going on, if he or she know what's going on, you might be able to offer something in the way of treatment.
And mental health disorders oftentimes have some physical symptoms, like if you're getting headaches or you are having stomach issues, that can actually, there's a connection, right?
Absolutely. So oftentimes, particularly in Western society, we are taught not to express our vulnerability. So we tend to hold it in. And we know that the more that we sort of point that inward, it can cause physical symptoms. And you might be surprised to know, Elizabeth, that the majority of primary care visits actually have something to do, quite honestly, with anxiety, depression, other mental health issues, whether or not that has led to sort of deleterious coping mechanisms like overeating or smoking, or actually the aches and pains that we're feeling are a result of internalized anxiety.
Do you think some of the mental health issues will end up being destigmatized because people who never struggled with anxiety before, they might have a greater empathy now?
That is such a good question. I think that we're moving in that direction. I actually think that's one of the things that social media has been very helpful, is that as much as people are often, posting about their perfect lives, we do often see people that are posting about some of their feelings and their losses. And so I noticed that we were moving in a certain direction, and generations, the younger generations, are a little bit more comfortable talking about their emotions than certainly older generations. And yes, I do believe that sort of going through something like this collectively as a generation, together, I think will bring us a certain language to describe some of the feelings that we have and maybe feel a little bit more forthcoming with sharing them.
Chrissy is saying, I fear how I'm going to survive. She still hasn't received her unemployment, and she says, she's looking for help.
Yes. So, there are definitely, some of us are facing some very difficult challenges, economic challenges, health challenges, etc. And what I want to say to you, Chrissy, is that something that we all do, even mental health professionals such as myself, when we are anxious about something, oftentimes we want to avoid whatever it is about it that is making us anxious. So I can only imagine that getting on the phone with unemployment and sort of going through those long wait times and trying to convince someone that you need help when already you're not feeling so comfortable with asking for help. Those are things that, you might not necessarily want to do the first thing when you wake up. But what I want to say to you is that even though all of your emotions might feel like you don't, that you need to protect yourself and maybe avoid the very thing that is making you anxious, what I'd say is move towards it anyway. Do what you can to advocate for yourself, do what you can to make sure that you are utilizing the resources that are available to you in order to get what you need.
Christine is saying, I've had anxiety for a very long time. This has been so hard, worrying about my kids, my family, praying for everyone, constantly calling everyone to check up on them.
Yeah. Christina, I completely hear you. I feel you. And, sometimes we have a little funny sort of equation in our head that maybe the more we worry about things, the better off we'll be, that somehow that mental energy that we use worrying will sort of keep the plane flying, will keep our relatives safe. But the truth is, the more you worry, it does not necessarily help you protect those around you, and it certainly deteriorates your quality of life. So give yourself a little bit of a break and, take a little bit more time for yourself, maybe engaging in activities like exercising or laughing with a friend or listening to music, something that you can do that will help yourself feel better, because the worrying is not magically going to help anything.
And it's interesting because Kimberly wrote in to say that she has anxiety, and she finds ways of coping by going outside for fresh air and going for a walk.
Yes.
Is a relief.
Oh, if you really look at the literature, there are a few things that we can do that are quite, authoritatively proven that can help us feel better. And one is being in nature, taking a walk in nature. That's incredibly helpful. Other things such as reading fiction that can help us escape, help us sort of see how other people are living and the choices they make and how that might impact their life, even though it's from someone else's mind. It's still sort of a life that we can imagine and put ourselves in. Things like starting a gratitude practice, journaling, spending time with friends and family. These are all things we can do to help ourselves feel better now and fortify ourselves for the future.
All right, great. We're going to continue to answer your questions, and we're going to continue this conversation. You're watching News 12. Okay, hi to everybody on Facebook. So this section is a little bit shorter. The first question is just a little bit lengthy. So I want to read it to you now. You don't have to answer it now, but just so that you can digest it, because the answers will just have to be shorter. So this says,
Okay.
The pandemic brought back anxiety, panic, and internal depression from September 11th to the surface again. What makes it harder is the surrounding environment where everyone joined together. We're too much apart. There's a lack of concern for our fellow man. I fear that I fear that I never had before. I'm afraid for my family. I'm afraid I'll get hurt by mobs. I did all things I could to be safe from corona, only to deal with all this. Okay. And then we also have, what do you believe normal life will look like from this point on, 6 months down the road or a year down the road? So we have less than a minute to try to see if we can answer those.
Okay.
Okay. And I'll try to maybe not read faster, but maybe.
No, I'll keep it brief. I'll keep it briefer.
Okay.
Yeah.
Just because there's a little bit there to get to. All right, so I'll jump right into it when we get there. And I know
Okay.
a friend of mine who's a nurse in one of the emergency rooms was saying to me that she was concerned about her colleagues ending up with post-traumatic stress from, like, she thinks she's seeing it now that the volume of patients has died down, and that a lot of her colleagues are just not the same that they were before, and that this seems to have changed them, which is obviously very upsetting for people who gave so much to then have those lasting mental effects.
I know, absolutely. I mean, that is a huge issue right now, is how to sort of treat and take care of our health workers who were really on the front lines from the beginning.
Yeah,
absolutely.
Well, you might lose my audio. We're about 5 seconds away.
Okay.
Welcome back. We do want to jump back into your questions. And Carol wrote to us saying the pandemic brought back anxiety, panic, internal depression from September 11th. It makes it hard for her to go together again. She's nervous for her fellow man. She has fear that she's never had before and doesn't really know how to deal with this.
Yeah, you know, one of the difficult things about trauma is that it recapitulates trauma. So I completely understand that you might be feeling some of the same way that you did around 9/11, which obviously is, you know, a trauma that we can all relate to, those of us who were alive during. And what I want you to do is to try to utilize some of those same skills that you used in order to move forward after 9/11, connecting with others, speaking to maybe a mental health professional, doing things that you know how to make yourself feel better, getting regular sleep, regular exercise, eating well, and again, of course, speaking to a professional.
All right, and Erin writes, what do you believe normal life will look like at some point down the road, a year from now, 6 months from now?
I want that crystal ball, Erin. I want that crystal ball. But I believe that we will be better off than we are today. I feel like we are moving in a positive direction. I think we have all the most brilliant minds in the world trying to work on a treatment and a cure. I think as a society, we're growing. And I think we're going to look better than we are today.
All right, I like that thought. Thank you so much, Dr. Samton, and thank you all for your questions. I'm Elizabeth Hasshagen. More news straight ahead. Yay, thank you so much. You were lovely.
You're welcome. Okay, good.
Thank you. All the best.
Thank you. I hope it was okay.
Yes, you were fantastic.